All right, welcome to your renal medicine posting at Ktph Hospital. Think of this as your go-to guide for the next few weeks. We're going to break down everything you need to know about nephrology to really get you set up for success. So let's be honest. Is the thought of managing these complex kidney issues a little daunting? Maybe even making you feel a bit nephrophobic? Hey, I totally get it. It's this delicate balancing act of fluids and electrolytes, and things can go sideways really fast. That feeling is super common, so you're in good company. And you know what? The most important thing is realizing you are definitely not alone in feeling this way. This guide is here to give you the practical tools you need to go from feeling anxious to feeling confident. We want you to not just survive this posting, but to absolutely thrive in it. Okay, let's jump into section 1. Let's frame this posting for what it is, a fantastic challenge. This is your chance to take all that general medicine knowledge you already have and apply it to some really specific hands-on patient care in the world of renal medicine. So, what's your mission? Simple. You are now the #1 advocate for the kidneys. Seriously, think about it. They're probably the most hardworking and honestly the most underappreciated organ in the whole body. Your job is to be their champion. All right, section 2. Let's get into the nitty-gritty of the team you're joining and what you'll be doing. It's a big, multidisciplinary group, so knowing exactly where you fit in is key to making a real impact on your patients. Okay, so here's the breakdown. The service is split into 4 core teams, and you'll be on one of them. Each team has its own patch, covering specific wards. This just makes sure everyone knows who's responsible for which patients, from the general wards all the way to the ICUs. Now for section 3. Look, this posting isn't just about your daily duties. It is a massive learning opportunity. So let's open up the learning playbook and see all the ways you're going to develop your skills. So check this out. You've got daily rounds, clinics, CMEs, a ton of opportunities. But here's the deal. Just showing up isn't enough. You gotta jump in. Ask questions during rounds, volunteer to present a case, really think about what you're seeing in the clinics. This is your chance to go deep, so make it count. Okay, let's get serious for a minute. We're moving into section 4. All of this, the learning, the teamwork, it's all built on one thing: patient safety. This next part is absolutely critical. These are the golden rules, the non-negotiables. This is all about keeping your patients and yourself safe. Let's start with the do's. These are the fundamentals. It all starts with empathy. From there, strict hand hygiene, and I mean before and after every single patient contact. When you write notes, make them authentic, no generic copy-pasting. And just as important, look out for your teammates and take care of yourself. Burnout is real. So, those are the do's, and they're your foundation. But, and this is a big but, the single most important thing is to protect your patients. And that means we need to talk about the absolute don'ts. These aren't suggestions, these are rules that directly prevent harm. First up, pethidine, morphine, or baclofen in patients with end-stage renal disease or advanced chronic kidney disease. Just avoid them. Why? Because their bodies can't clear the metabolites, which then build up to toxic levels. We're talking severe complications like respiratory depression. Next, fleet enemas or oral phosphosoda. The answer is just no, absolutely not. For a patient whose kidneys are already struggling, these can cause really dangerous shifts in phosphate and other electrolytes. It is not worth the risk. Be super cautious with blood transfusions that are given outside of a dialysis session. You might be wondering why. Well, you risk causing acute fluid overload and life-threateningly high potassium because the patient has no way to excrete that extra fluid and potassium. Listen up, because this one is critical. Do not, I repeat, do not take blood from the forearm veins of any ESRD or advanced CKD patient. Think of those veins as vein capital. They are a precious resource that we have to preserve for creating a future fistula, which is literally their lifeline for dialysis. You know how they say timing is everything? Well, it really is here. Drawing blood for a full blood count or a renal panel immediately after dialysis will give you completely skewed results. The values will be all off, and that just leads to poor clinical decisions. And finally, do not order coagulation studies like a PT or a PTT from a dialysis catheter. Those lines are locked with heparin to prevent clotting, which means it will always contaminate the sample and make your results completely unreliable and basically useless. All right, we are on the home stretch. Section 5. We've talked about the teams, the learning opportunities, and the critical safety rules. Now let's boil all of that down to the single most important principle that should guide every single thing you do during this posting. This is it. This is the core take-home message. If you remember one thing from this whole guide, let it be this. There is no shame in being unsure. The only real mistake is not asking for help. Your curiosity and your humility are your greatest assets. They will keep your patients safe, and you will learn so much more. So please, always, always ask when you are unsure.